Welcome everyone to another episode of Empower Speaks Healthcare Talks. As always, I'll give you some background information about what the purpose of this podcast is. As the name suggests, the idea is to empower you, whether you're a patient, whether you're a clinician, whether you're an individual in senior leadership in the healthcare ecosystem, or you're an entrepreneur. The idea is to invite these individuals to the table and have these conversations where we can pick their brain and understand some of the challenges in the healthcare system and how to navigate those. Now, today we have a very special guest. We mentioned, having a patient on. So today is the first time we're able to invite a patient to the table to have this conversation and to navigate their journey. So we have Josh Rheaume, who is an individual who has severe asthma. And before I hand it over to him to share a little bit about his journey to where he is today, he also has his own podcast, Beyond the Wheeze, which he'll also talk about. He's an advocate, keynote speaker. There's so much that he has done with his journey. We're going to pick his brain and learn a little bit more about that. Now, before I hand it over to Josh, I always like to share how I met my guest. So Josh and I actually met a couple months ago at the Lung Summit at Mars Discovery District. And there, DIA Labs Canada was hosting this event, Lung Summit. And he was one of the keynote speakers there. And so he shared a little bit about his journey. Now, my sister also has asthma. So as he was sharing his journey, it resonated quite a bit with me. And so afterwards, towards the end, I went to speak to him and I shared that and I told him I really appreciated you sharing your journey because it resonated with me that having a loved one that has gone through that. We spoke about how, using an inhaler where when she was very little, my mom had to learn how to use it with the chamber. The pharmacist taught her. And sometimes individuals don't know how to use it to allow the individual to have some relief and be able to navigate their lives and improve their quality of life. And so based on our conversations, we learned that we both have a podcast. So we were going to do a podcast takeover and, be on each other's. And so that's how this conversation started. So I'm so excited to have Josh here so we can navigate his journey. So Josh, I'm going to hand it over to you to just share a little bit about first, what is severe asthma so the audience can understand what that means for an individual. And then secondly, if you could share your journey from the get-go, when you did realize that you do have severe asthma and how you navigated your journey up until today. So please take it away.
Hi, Fahreen. First of all, thank you so much for having me on. This actually is my first podcast takeover. I've been fortunate to be on, a couple podcasts in the past, and of course I host my own, but my first podcast takeover. So thank you so much for having me. It was a great honor to meet you. So I'm glad we can continue that conversation here. So severe asthma, well, a lot like asthma, I think everybody really can relate to what asthma is. So shortness of breath, chest tightness, cough, wheezing, other symptoms, gasping for air, really things kind of like that. Now, severe asthma, really, it's a condition on its own where symptoms are a little bit more difficult to control, even with higher dose medications. And with severe asthma often comes different and more potent and often newer medications as well, such as biologics, which I'm sure we can talk about a little bit today. But with severe asthma comes uncontrolled symptoms, increased reliance on medication, so needing my emergency inhaler a lot more often than most asthmatics might. So most asthmatics might have good control over their asthma, just taking their controller medication. Now for me, or for people like me, that isn't always the case. And triggers, or any kind of triggers, really part of everyday life, can really set an attack. And those attacks can be, unfortunately, fatal at times. So it's important to stay on top of it when you can. So severe asthma, it's not a good thing to have. And unfortunately, there are a lot of severe asthmas. There are a lot of severe asthmatics here in Canada.
Yeah. No, I appreciate you kind of giving that background. And I remember when we were speaking after the Lung Summit, where we talked about, where I shared a little bit about my sister and where you said that as an individual, as a patient, you had to kind of figure out yourself what your triggers were. Because for every individual, it is different. Like for my sister too, it took some time. And so based on that, like how you determine what your triggers are, what your journey was as, as a child, being an individual with severe asthma, if you could take us through that journey and also identifying what your triggers were, because I think for any audience member that has a loved one or themselves going through that, I think when we spoke about it, that was the main piece where you need to figure out what triggers you so you can best protect and be proactive for yourself. Yeah.
100%. So the thing with asthma, asthma really is an illness or disease of self-discovery. All our lungs are built a little bit differently. We all have our own triggers. Now, for me, my battle with asthma started when I was young. I was diagnosed with severe asthma as a baby. I was in and out of the hospital quite a bit. Now, things were bad for me. I was a diagnosed severe asthmatic at a young age, but things really took a turn for the worse when I moved to Nova Scotia with my family at a young age with my mom and my three other siblings. Now we moved there, we moved into a house that was built in 1867. And at the time, it seemed like a great idea. My mom got a wicked deal on the house. You know, $50,000 is certainly not going to pay that now for an old farmhouse with a barn and a couple acres, right? It was amazing. Now, little did we know is, well, I'm allergic to cats. I'm allergic to dogs. I'm allergic to farm animals. I'm allergic to dust mites. I'm allergic to smoke. And I mean, we lived in the Annapolis Valley, Nova Scotia, which, if you know anything about the Annapolis Valley, Nova Scotia, it's the apple capital of Nova Scotia. Now, what happens, certain times of the year is they trim those apple trees and they leave them there and they burn them. And those burn for months and months on end. Now, we lived right in the middle of that. So everything, whether it was my home or whether it was the environment outside, affected my breathing. From the ages of, I would say, roughly whatever you are in grade three, the time I moved to Nova Scotia till I left at the age of 18, 19, I spent an average of about 3 to 4 months in the hospital per year. Now, the tough thing with that is, had my mom known at the time, had I known at the time really what was causing me to need to be hospitalized that much, doesn't really matter what kind of socioeconomic status we were in. We're living in poverty, things were challenging, but my mom would have sold that house in a heartbeat. We would have moved in a heartbeat and left those conditions behind. Unfortunately, we didn't know. So the hospital really did become a revolving door for me. I would go right into the hospital. I would start feeling better. I had nice, clean, sterile air, spend a week or two in there, and then I would be released and I'd go back home to those conditions. I would get sick again, and a week, 2 weeks later, I would start really suffering, really having a hard time breathing to the point where, I was complacent with it, so I would wait until I would faint. I would pass out. I'd be at school and I would collapse and have to take an ambulance. It became a regular thing for me, and I'd go right back there in the hospital. When I was 18, 19, my respirologist at the time suggested, hey, Josh, maybe you should consider moving. Maybe something here is just not working for you. So I left. I left Nova Scotia for college. It's when I came to Ontario, went to school in North Bay, and I noticed a big difference right away. Now, I figured, okay, it's the climate, it's the humidity, it's better here. It's not a lot. It's not like back home. But then as I returned back home for Christmas vacation or various holidays, I could only really be home for a couple of days before I started feeling that in my lungs again, and I would be right back in the hospital. And eventually I put two and two together, did my research, I learned my lungs, and then I learned, okay, that house is not good for me. I'm going to stay away from there. Fast forward a little bit. So I'm 34 years old currently. I was 20, I want to say 28, 29 at the time of my wedding, and now I weigh 280 pounds. That's not good, right? And I wanted to do something to lose that weight. And for me, what that looked like wasn't just a diet change, it was running. Now, I wanted to do something that I was scared to do because doctors had always told me, Josh, don't run, don't do this. It's going to make your asthma worse and you're going to be right back in the hospital. But I took a chance. I had better control of my lungs. Now, the exercise factor still affected me, but I went out, I went for a run, made it 100 meters. The next day I returned, made it 200 meters, took my inhaler, 300, 400, 500, so on and so forth, until I was running marathons with Asthma Canada on my back, representing them as captain for Team Asthma. And it felt absolutely terrific. And that's really what led me down this path of advocacy is seeing how bad things could be, but then seeing how good things can be with just a little bit of education and learning yourself inside and out. And I wanted to help other little Joshes out there to enjoy their lives just a little bit more. So that's what brings me here today.
No, that's awesome. And thank you so much for being open and vulnerable and sharing that journey with others as well. I think there is so much to unpack there, where you said about determining your triggers and how you figured it out that it was home that was causing it and what those factors were. It resonates with me. Well, like I said, my sister has asthma as well. And similarly, when she was very young, when she was born, she was born with asthma. And so navigating that, like even like we were talking earlier when we hopped on for our session today, where with the wildfires, the pollution, all of that, even for her, she just went for a walk. She came back home and she's like, my breathing is on, so she had to take her inhaler. So things like that. She went to Whistler a year or two ago to go skiing, and the altitude, that too triggered her as well.
Yep.
And so, like you said, like the inhaler, we went to New York last year, same thing, the pollution, she had to keep her inhalers on her. So, like you said, understanding and being aware, like, hey, this may trigger me, or sometimes you don't even know with things changing in the world. So, I appreciate you sharing that. And I hope any audience member, whether it's yourself, whether it's a loved one, for this may be a generalization that generally there are things when you have a condition that may be triggering and you have to be that investigator and figure out what that is to understand what is triggering me. So I think that's piece number one. So I appreciate you sharing that, and that resonates very much. And then the other piece where you said about where you were told not to exercise. And then when you did decide to make a healthy change for yourself and take those baby steps, like you said, 100 meters, then 200, and now you're running marathons. I think that's so key. As I've shared before, like I was doing my master's in physiotherapy, but due to an injury, I wasn't able to complete it. But we always used to say, like, the reason I wanted to pursue physiotherapy was the holistic way of using your own body to heal yourself, and that is through exercise, through within parameters, within what your limitations may be, and being mindful of that so you're not harming or hurting your body. But I loved how you shared that running gave you that power to help yourself, right? And so use your body to train it, train your lungs, train yourself. And like I said, no medical advice here, but just trying to share how sometimes we think of exercise as a buzzword, and everyone's talking about it, but there are there can be positive side effects that you can use, being mindful, being respectful of what your parameters are. So yeah, so I appreciate you sharing that, and kind of how you said that when you were running, you had like Asthma Canada on your back. And so fast forward to today, you have your own podcast, Beyond the Wheeze. You also are, a keynote speaker, you're an advocate, all of that. Do you mind sharing what prompted you? I know you shared a little bit about why, helping other little Joshes out there so they don't have to go through what you went through. But is there a bit more that you can shed light on why you decided to do all these avenues to allow yourself to share your story? Because it's not easy being vulnerable every single time. When you met with me, you shared your story, then you're sharing it again, right? And we're human. So if you mind sharing a little bit of light on that piece.
Absolutely. And, I think vulnerability is a gift. I think being able to be vulnerable is incredibly important, not just for you and to be more open with yourself, but for others as well. And I think what we have, we can share. Now, I kind of have a motto when I started what I'm doing now, and that's really only you define your true limitations. So having a doctor say, you shouldn't exercise, well, that's somebody else telling me what I shouldn't do. Now, again, not medical advice. So if you are asthmatic, you want to get out there and you want to go for a run. Now, we do know now today, I did have Dr. Alan Kaplan on one of my recent podcast episodes where he talks about the benefits of exercising for asthmatic lungs. And he said he would rather see individuals sitting on the couch, he would rather see individuals taking their inhaler and abusing their emergency inhaler while out for a run than sitting down on the couch doing absolutely nothing. And it makes perfect sense. Now, there is a proper way to do it. There's a way to learn how to train. So I advise all you listening out there that might have asthma that want to go out and do that step as well. There's a proper way to do it. So learn how to do it safely so you can do that. Now, as you mentioned before, so being able to help those little Joshes out there. So how it really started and what brought me here, I started an Instagram account when I started running, and it's called the Asthma Runner. And I started documenting my journey running with severe asthma. Then Asthma Canada reached out to me and brought up the whole marathon idea. Hey, do you want to do this? And I'm not going to say no. I mean, that was terrific. They were kind of aligned exactly with the goals that I had. So I said, yeah, let's do it. Let's do it. Now, around the same time, my wife gave birth to twin girls, Lily and Lennon. And it was November 11th, 2022. And I started a TikTok channel, so totally unrelated to all this stuff. I started a TikTok channel where I had my smart dog go and fetch bottles out of the fridge, shut the door, go get diapers, go get wipes, really do everything I needed her to do. And then having done that, we blew up, got, 200,000 followers in a matter of weeks, went viral, multiple times. And I had news stations reach out to me, CBC, CTV, News Nation, Good Morning America, and they reached out to me for interviews. And it was doing these interviews that I realized, okay, I'm decent at speaking. I'm an okay storyteller. Now, how can I leverage this with something that I'm actually feeling passionate about? So I started really kind of doing that in the asthma space. So more than just running marathons with Asthma Canada on my back, I would put my name out there to go speak at events and conferences, and I would tell people my story. And I think that was important. Now, the conferences that I typically speak at are more for healthcare providers. So you'll have respirologists there, respiratory therapists, physiotherapists, kind of really a whole bunch of healthcare personnel. So when I go in and I tell my story to them, it's more than just looking at a chart, which they're used to seeing. It's talking to an actual patient, which has been through that and witnesses that, on a daily basis. And one of the feedbacks that I got after just my first chat was from a respirologist, and it was how refreshing it was to hear from a patient. For him to go to that event and not just hear from other doctors talking about severe asthma, but to hear from somebody that's been through it. And then that was just a big motivator for me. I always found there was a gap existing between healthcare providers and patients. I mean, obviously there must have been some sort of gap there if I struggled for 18 years with severe asthma before I learned that my house is killing me. So I wanted to do something. I wanted to kind of give that knowledge that I now had back to people in a way that I could, in a way that I was good at. So I was okay at speaking. So then I started a podcast, and that was actually rather recently. I started that last November. And really since January, I've been releasing an episode a week. So it's been super busy. But on that podcast, I have healthcare providers and I have patients and I have caregivers that have lost loved ones to severe asthma come on and talk about their experiences. And with a healthy 50% of my listening base being healthcare providers, I really am kind of bridging that gap in the communication between, the different spaces within the asthma space. So just knowing that I really could make a difference, seeing it happen was enough for me to continue doing this. And I hope to someday make a future out of this. I hope to continue my podcast. I hope to be able to leave my day job at some point so I can do this full time. And I hope to write a book one day. And that's my way of being vulnerable, being open, and helping other people where I can.
Yeah, no, that's beautiful, and thank you for sharing that. There is so much there, so I'm gonna try to,
That's a lot.
peel back those layers and try to dig in a little bit. But I think that's so true. Like you said, it's starting somewhere, sharing your story in various platforms. That's how we connected, right? If you hadn't been a speaker and hadn't shared that story, and me being one of the audience members and hearing that and being able to resonate with that because of a loved one, we wouldn't be here. So, like you said, this, it opens up opportunities. So I think that's so key. Even sharing that with the audience, right? Where sometimes we are a bit hesitant to take that step. I think it's so critical. We are examples of that if we had not, we wouldn't be here where we are today. The other piece where you said that in enjoying storytelling, in finding platforms that when we were speaking with each other at the end of the Lung Summit, that's kind of for me as well, right? Like I love public speaking. And so instead of waiting for platforms, I'm going to create my own and bring my passion of digital health and conversations and empowerment and patient empowerment and clinician empowerment, you name it, to have these conversations. And that's how, being able to bring you on as well, being our first guest, that from a patient perspective. And I think that is so key. And then you said a lot of the platforms where you've spoken at, where you had a provider share with you that they appreciated having a patient speak. Because a lot of times providers will speak with one another, share their stories, but having firsthand a patient discuss that. Now, I want to kind of piggyback off of that. A lot of the times we talk about having patients having a seat at the table. And whenever I say this, I always tell everyone, we talk about patients as if it is external to us. It is third party, when it's not. We are all patients. It doesn't matter who you are, what your title is, what your profession is. At some point, whether previously, in the future, what have you, we all are. And so the question that I want to broach with you is, as a patient, now that you have been advocating, have you been brought to the table to have conversations, whether it's a policy change, whether it's a device, whether it's a digital health app, to bring your feedback so that we can improve and we can bring patients to the forefront? Because I feel like we speak about it a lot, and and it's mentioned quite a bit, but do we actually make it a reality? So I wanted to kind of pick your brain about that, if you have any insight to share on that.
Absolutely. So some of the things are actually work in progress right now that I don't have a whole lot of information on myself, but I've been invited to take part in various research opportunities, which is great. But thus far for me, and where I've seen it actually in play and help out, I did attend Asthma Day. I went to Queen's Park in Toronto, and I attended that, and I got to speak to policymakers, local MPPs. So actually, my local MPP here in the Nickel Belt District in Sudbury, Ontario, I got to speak with her, and I got to speak with the various independents, Liberal and PC as well, which is terrific. So we're asking for money, we're looking for change, and we're saying really what our goals are. So again, kind of working alongside Asthma Canada as well, doing some advocacy work with them. So that's one thing that I've done, and I've been asked in various situations as well, and I've been part of various interviews with I want to say healthcare providers and news stations too, where they're talking about app literacy or digital literacy towards asthma. So what can you believe? What can't you believe? Now, I'm not a doctor, so I'm speaking from the patient perspective when I do it. I recently spoke with the Ministry of the Environment, Parks and Conservation about wildfire season, wildfire smoke, and what that means really to an asthmatic or really anybody with respiratory issues, because they have, a certain amount of funding that they put towards air pollution initiatives, and they put towards keeping their parks clean. Whatever it is, those people all in one space there to listen to me talk about why it's so important. So we know that we're putting those ideas and that knowledge in the right hands to see change happen in the future.
Yeah, no, I think that's so amazing because, and the reason for me that I say that is because I'm always wearing that digital health cap, and I think about, okay, we're talking about apps and devices and all that, but like you said, it can be something as simple as policy, right? And so I remember one of my first papers that I was a primary published author for was the design for Canadian Digital Health Policy and Practices Observatory, and I remember speaking to the individual who also worked with me on it, Dr. Karim Keshavi, and he always said, he's like, policy has an impact, and you have to, the parameters in which people work are through policies, right? Some of it can be legislation, but policy is a bit easier to navigate, and people do abide by it in how you navigate. So I think it's so beautiful that you mentioned that the impact you're having, being invited to research, trials or what have you, so you can dabble into that space, but also policy on a larger scale to have that impact. So I think that's beautiful on highlighting the importance of policy, because sometimes we just kind of throw it around. So I think that's amazing that you've shared that. Kind of building off of that and kind of backtracking to when you were younger and you were diagnosed with severe asthma, your journey from then till now. Are there certain devices that you use, whether it is, a mobile health app that you use to help monitor certain things or what have you? And the reason I share this is I've worked in the home oxygen space. And so there we did, we tried to implement a product where it allowed for self-monitoring. So we had like Bluetooth devices where it could monitor the patient's oxygen saturation levels. And if it dropped a certain level, the respiratory therapist would be made aware, and then they can navigate that. And so just wanted to ask you if there were any devices that you used when you were younger or that you use today, or things that you have noticed that are gaps that you wish are addressed. So I know that's twofold. So maybe we'll start with the first half of what you do use, whether it was when you were younger or now that you currently use, and then we'll tackle the second portion after. So please, yeah, Josh, go ahead.
Yeah, so unfortunately, not a lot has changed really in the asthma space in regards to technology and, the past 2 decades, at least really since I've been kind of in that space. Now, with AI coming out, the potential's huge. And I have had a couple individuals as well that have startup companies in the AI asthma space that have started creating things that can track your breathing, and things can be flagged and sent directly to respirologists or doctors, because often we become complacent of our own breathing and we don't really feel something happening until it does. So coming down the pipeline, there are going to be things, and I'm really excited for that. Now, I want to say from now until back then, I've old fashioned, I've used a peak flow meter. Now we do have digital peak flow meters now, and it's easy to, again, be complacent as a child or as a young adult and think that they don't do anything. But they really do. They serve as an indication to let you know that something might not really be good right now. Something's kind of happening, something's starting. Now, in regards to Bluetooth, devices and stuff like that, I don't have a lot of experience in it. I frankly, I don't know if they really exist, or at least not something that's standardized, unfortunately, at this point. But again, with AI, I do see that coming down the pipeline. Now, things like weather apps are terrific for monitoring the air quality. Right now, we are in somewhat of a wildfire season, especially here in Sudbury. You look outside, it's hazy. That's affecting my breathing. So what I can do is I can control my breathing inside by setting up air purifiers, and I can limit my outdoor exposure. That's what I can do. So having apps, simple weather apps that monitor air quality is huge. That makes the world of a difference because I'm stopping potential attacks from happening, or at least limiting them where I can. Now, in regards to app literacy, so we want to go down, kind of that technology. I did listen to a speech recently, and I think you did as well, by Dr. Shirley Quach at DIA Labs Canada, and she talked about app literacy. What can we trust out there? What do doctors stand behind? And unfortunately, there's not a lot. Now, she covered COPD and asthma, and there are no apps that everybody agrees on. Unfortunately, don't put your faith in an app, because usually what they are is you go onto an app, and what you're going to see is you're going to see a link to take you to information on the web somewhere. But that information itself, you're not going to find in the app, and it's certainly not created by any doctors. So maybe not an avenue we can really rely on yet. But I got to say right now, kind of holding my breath for AI to really change the asthma space and bring these new technologies to light, which I do know are being developed, and sticking to what works. So the peak flow meter, if you want to update it a little bit, go to the digital peak flow meter, things like that really help. And just to kind of go back to the policy a little bit. So I was part of a policy workshop last year where we discussed the gaps in healthcare. We discussed the gaps, in asthma care and what we need more of, spirometry being one of them. So spirometry is a simple test that you take, the breathing test that you take, and you have to have somebody that's certified to read those results. Unfortunately, as important as it is, because it is required for diagnosis, or proper diagnosis of asthma and proper management of asthma, we just don't have enough of them. We don't have enough people that can read those. So when we do these policy chats, when we get together and we talk to various policymakers or legislators, whatever it is, we ask them to expand where we can find those spirometry testing, how we can incentivize the people that can read those so we see more of it, and really, kind of factor in how important it is, really, because we have 4.1 million Canadians, something like that have asthma. That's not a small issue. And something like $1.90, I mean, I could be way off, but I actually think it's $1.90 based on a keynote speech that I attended recently, that goes towards each Canadian per year in asthma. That's not a lot. That's not a lot. When you look at asthma, which gets hundreds of dollars per patient, that's huge. And when you have 4.1 million sufferers in Canada, well, I mean, I think we deserve a little bit more attention than that. Sorry, I kind of went off on a tangent there, but
Yeah.
I think they're important topics that need to be discussed.
Yeah, no, that's amazing. And just for the audience, do you mind explaining what a peak flow meter is so that they're aware of what that means and what that instrument or device is and how it helps you?
Yeah, so a peak flow meter, actually quite simple. So it measures your output, your exhalation, really. So it's going to give you a value. I forget exactly how that's measured, but based on that value, you don't really need to know exactly what it means. But if you're a kid, you're looking at it, well, you're going to see that that's just a little bit less today than it was yesterday. So taking those simple values, you can learn a lot about your lungs, and it tells a lot to doctors about how you're doing, because those records are kept. So yeah, it measures simple, I want to say respiration, but we'll say it measures your exhale, and it determines based on a value how you're currently breathing, really,
No, that's
in layman's
amazing.
terms.
Yeah, no, perfect. Yeah, thank you for explaining that. And I think you're so right there. The talk that we both attended at the Lung Summit, where there are so many apps and it's not standardized. And that's where it makes it difficult for,
Yes.
as a patient, where you don't know what your go-to is. And when you don't know that, you may use something, but you don't know its credibility. You don't know whether it is giving you the information that you need. And it can be very overwhelming if you go to the App Store or Google Play Store, and there's so many apps for you to kind of dive into. And so I think that's so true in terms of being able to navigate that and knowing what apps you should use, what devices you should use. And like you said, it's quite interesting to hear where you said that from, dating back from when you were a child into now, where you said that you haven't seen much progress. And so that kind of tells us that there's so much that we need to address. Like you said, there's a lot of hopes on AI, artificial intelligence, hoping to bridge some of those gaps in making sure we do it in an ethical manner and all that, but to help navigate that. I think something earlier you had said about digital literacy, and also health literacy. And so how you said that when you're invited, you try to share from a patient perspective. And I think that's so important because previously in talks that I've even given where health literacy, given that I am in the healthcare space, I'm able to navigate it. My sister, she's on the legal side, she's a lawyer, but sometimes she's even like, I would not have known to do this. And so it's important to note that health literacy is important on how you're able to navigate the system. And like you said, now being a patient, being part of various avenues, you're able to increase your health literacy. Now, with all these technologies comes the digital portion of it, digital literacy, right? There's social determinants of health, socioeconomic status, everything that will play into that, and where it's important. And like you said, you try to share your perspective. But one piece you said about in having the data, whether you're collecting it through spirometry or what have you, whatever devices you're using, those data points are important. And in one of the talks I'd given where patients should have access to their health data, even if you may not understand what those numbers mean, to have that data that when you go see the physician or you learn to have what those mean for you is very important. So kind of navigating through that in your position as a patient that is experiencing that and you are trying to advocate, what would you say is the number one piece or number one gap or area that you wish is addressed or that you feel could have a larger impact in whatever avenue, whether it's policy, whether it's a device, whether, medication, inhaler, whatever it may be, but just from your perspective where you've been like, you know what, that gap I wish was addressed, or you did identify and now you do see a change. Anything that you see that maybe others experiencing aren't able to pinpoint or put their finger on, but you have and you would like to share.
Yeah, so this is one I'd like to circle back to the importance of the patient perspective because usually when we have these individuals talking to healthcare policy makers, what have you, well, they're usually healthcare providers themselves. So it's easy to see a gap in testing. So spirometry testing, it's easy to see a gap in medication and, really how expensive medication can be because biologics right now, I think it's $2,000 per shot every 2 weeks. If I were to get, now it depends on the biologic you get, I'm sure. But for that reason, when I was a kid, I could never get it because it wasn't covered. And I mean, who can afford $2,000 every 2 weeks? But the biggest gap and what could have changed my life drastically and many people that I know as well. I spent a lot of time in sick kids in Halifax, Nova Scotia. I met a lot of individuals that had severe asthma. Is education. Having that educational piece there is huge. And it sounds so simple. I promise you it is. But having that educational piece there, now that's going to make the world of a difference. Now, I'd just like to relate it back to my story. Had I been taught, had I known really what those triggers back home, had I known about those triggers to start with, had I known what they were doing to my lungs, had somebody been sent to my household to see exactly where I lived and how I was living, that could have changed my life drastically. And I mean, in turn, that would have saved how much dollars in the healthcare industry as well, right? I mean, I took air ambulance on a couple different occasions. I took ambulance rides a few times per year. I spent 3 to 4 months in the hospital per year as well. That was huge. Now, all I needed to be told was your house is killing you, leave. And I would have been gone. So educating patients, I think, is key. And again, that's why I do what I do, so I can educate those patients and try to prevent kind of what I went through, at least where I can. So yeah, having someone there to educate you, educate the caregivers as well, and even educate the healthcare providers, because it's easy to look at a medication list and be like, you know what, I'm going to up this, or maybe I'll throw that in and it's going to be okay. But really, you're just putting a Band-Aid on an issue, and it might not even be a very good Band-Aid. Educate the patient so they can understand that they have control, empower them a little bit so they can make that change themselves. I think really is the most important piece. And again, that's why I do what I do.
Yeah, no, that's beautiful. I love how you just kind of closed the loop there. I think that's so critical. Like you said, education. What we're both doing with the podcast is to empower patients with the knowledge so that they can get the care that they need, navigate certain situations, right? So education is so important. And even at the Lung Summit, you and I were talking about inhalers. And when you're a child, it's not the easiest thing to use. And I shared with you where they use the chamber, so it's to make it easier for a child to use it. So you attach it at the end of the inhaler, and then you use it that way. And so it's easier for the child, but you may not know how to use it. You may not know that this even exists to make it easier if you have a child, or regardless of what your situation may be. And so I think that's where you're right? That's the education piece. We were lucky enough that the pharmacist that was, my mom went to go pick up the prescription. They were kind enough and knowledgeable enough to show her how to use it for my sister, right? And so I think, like you said, education is so important there. The other piece that you tapped on was about certain medications being very expensive. Inhalers are expensive. So I think that's also navigating the piece about socioeconomic status. Right. So
Yeah.
we even saw that with the pandemic, where, you're living in close quarters or what have you, your socioeconomic status impacted how you were impacted by the pandemic. That happens with all other aspects of healthcare. That's why social determinants of health is so important. Right. So when we're talking about medications, I remember, so dating myself back in the day, things may have changed now, but physicians could give samples. Right now, there's it's more stringent, not necessarily as open to those spaces, but a lot of physicians were able to, they would ask you, do you have insurance? And if you don't, if they have a sample, they try to navigate. So it did help patient populations that were from lower socioeconomic status that needed a little bit of help financially, what have you, so they could get the medication that you want. Sometimes you'll hear, from colleagues of mine that are pharmacists, where individuals will be like, you know what, I won't take that medication right now because I don't have the financial means, but I'll take this or what have you. So I think that's so important. I'm grateful that you share that point. It's very vulnerable to share that this can be a hindrance to care. But I did wanted to hone in on the education portion, as well as the socioeconomic status of it to navigate as an individual with such a condition. I saw you nodding. Was there something you wanted to add to that piece before I move on to the next portion? But I wanted to give you a chance on that.
So going back to the pharmacist, right, teaching you how
Yeah.
to use an inhaler properly. Well, I mean, that's common, unfortunately. A lot of people don't know how to use an inhaler properly. They're not really told to fully exhale, get rid of that carbon dioxide, and then, breathe in your inhaler, whatever it is, and then hold your breath. A lot of people don't really know how to do that. Now, I learned how to do that after years and years and years of hospital visits on YouTube. Now, that's not right. I learned that on YouTube. And going back to samples as well, fortunately, there are still healthcare teams out there that will give out samples, which is terrific. I think that's amazing, and I think that's something they should continue to do. And when I would, go in, they wouldn't just give me one inhaler; they would give me like a whole trove of them, which is
Yeah.
great because, like you said, they're not cheap. I mean, $200 a pop for,
Yeah.
I'm not going to mention the names of, the inhalers, but it's crazy. And I mean, living in poverty, we barely had food on our table. We went to Salvation Army. Like, we had our pipes freeze in our house every winter because we couldn't afford to heat our house. And then unfortunately, when we could afford to heat our house, I found out that wood heat is the worst for my asthma. So that was, a problem in its own. But I think I think it's amazing that they do that, and I hope it's something they continue doing forever. I think that's terrific because, like you said, we all come from different backgrounds.
Yeah, no, and I think that's so important, like you said, that you watched on YouTube. So even us sharing our podcast, right? Like it is so that a person searching, trying to figure it out, if they come on, any of our podcasts that can help them navigate the information, that's the goal, right? And like you said, it's unfortunate that at a later point in life, that's how you learned how to use it properly. And like you said, having samples and being cognizant of that to allow and help individuals in a lower socioeconomic status so they can get the care that they need. Because sometimes, like you said, it's the medication. If you can't, even put food on your table, how do you, be like, okay, no, I'll buy the medication, but I won't eat. Like it's so hard. And I love the fact that we're having this conversation because I think it's us being real and vulnerable and raw, that this is a reality in life. And this is, for a patient and hopefully in the audience, some of you can resonate with us and have an appreciation why it's so important and why we have these conversations and having these podcasts. be able to do this. I think there's another piece where you said earlier when I said certain devices or what have you that you could use to help yourself. And you said something that's not necessarily medical, where you said that just the weather app, where, while we're having wildfires, the pollution that helps you. I think that's also beautiful that sometimes we are so focused on just healthcare when we need these apps, we need these devices, which are important, but also other factors around you. And I think that also goes to understanding what your triggers are. Like I said, for my sister, she knows when we were in New York or when she's going to Whistler, altitude. Okay, I'm cognizant the air, the weather can impact me. So I make sure my inhaler, when we were just walking around, we were at the Christmas markets, all that, she had her inhaler on her in case she got triggered. And so I think I appreciate you pointing out an item that is not necessarily medical, but very important for a patient and an individual that may navigate that space. We
Absolutely.
yeah, we talked like how we spoke about pharmacists, we spoke about respiratory therapists, physicians, family physicians, you name it. For yourself, who was part of your care team? Because as I said, I was, studying to become a physiotherapist, but due to an injury, I wasn't able to. But even for us, we are trained on cardio arrest. So we do treat patients that do have respiratory conditions. And a lot of times people think of physio as this, we just do exercise. And
Right.
no, we do more. And so I think it's so important that people are aware that there are other healthcare providers, allied health, what have you, that can also help you. Physicians and nurse practitioners, all that is common and we're aware of, but there are other players in your care team, in your circle of care that can also help you. And I think that's important. So I just wanted to hand it over to you if you could shed some light on your care team or certain healthcare providers that you've interacted with that maybe individuals aren't aware of that they can seek out help. And some of it may not be covered by OHIP, very upfront about that, and maybe through your insurance or what have you, but I think it's still important to have these conversations. So yeah, I'll just hand it over to you however you want to navigate that piece.
Yeah, so I'll start off with what doesn't need to be covered by OHIP because it doesn't cost anything. And I'm going to go back to Asthma Canada. So they have what's called the Asthma and Allergy Helpline. You go onto their website, you find that number, you call that number, and they're going to put you in touch with a respiratory therapist, a doctor, somebody that really knows respiratory conditions that can really help you. Now, particular to asthma, that's terrific. Now, I didn't have that as a kid. And that resource is there and it's absolutely free. So please take advantage of it. If you have any questions at all, it doesn't really matter what that is. Now, my healthcare team is actually quite small now. I do know my lungs quite a bit. I do have rather good control over my breathing because I know kind of how to mitigate that. Now, my healthcare team comprises of my family doctor and my respirologist, which I think most severe asthmatics can say. Now, out there as well, we do have respiratory therapists. We do have physiotherapists. Unfortunately, those were never part of my healthcare team, but that is something that I advocate for is having a respiratory therapist or a certified respiratory educator, a CRE, in every healthcare team, every primary care team, because I think it's important because you can't expect, I'll just give you an example. You go to the hospital and I went to the hospital a couple of weeks ago. I went to Emerge, having a hard time breathing. Now, every asthmatic presents a little bit differently. When I present myself to the emergency room, I don't present with wheeze. I present with a tight chest. Now, unfortunately for me, you could check my oxygen saturation and I'm going to say 96, 97%, but I don't feel that way. I could pass out the next second. That's just how my lungs are. If you're not checking my respiration, you're not checking my cap gases, and that's just technical terms, then really anything could happen to me. And what usually happens, what happened last time, is they said, okay, you look fine. It's an 8-hour wait. And then you can see the doctor. Now, I had to go back to my truck. I had to plug in my nebulizer and I had to take my nebulizer while I was waiting to see a doctor. Now, if you had a certified respiratory educator there or a respiratory therapist there, then you probably would have been able to get the help you need because those people specialize in that. You can't go to the emergency room and expect every doctor to know asthma. It's rather, I don't want to say rather niche, but it kind of is. Not every town is going to have their list of severe asthmatics. And like I said, we all present a little bit differently. So having respiratory therapists or certified respiratory educators as part of a primary care team is important. So if you're listening to this and you you're a severe asthmatic or even an asthmatic who wants those resources available to them, ask your doctor, how can I get in touch with a respiratory therapist? Can you make a respiratory therapist part of my care team? Because that's incredibly vital. But yeah, to keep it short, mine is I have a respirologist I see every 6 months, and I have my family doctor where I see any time in between. Now, the thing about severe asthma is you don't know how it's going to flare up. You don't know when it's going to flare up. So seeing a respirologist every 6 months, unfortunately, on its own, it doesn't quite cut it.
No, that's perfect. And I appreciate you sharing that. When you said a nebulizer, do you mind explaining to the audience what that is and why you had to go to your truck to use it?
Of course, yeah. So in layman's terms, it's really getting your inhaler constantly. So you put on your mask, what you might see on TV when you have a patient with their mask on, you see the steam coming out of the sides. So what that is you're putting in a liquid, salbutamol or Ventolin. Again, not a doctor, so perhaps I'm wrong. I don't think I am. And then that is turned into a gas, which is constantly fed into your lungs. And the idea of it is to clear you up. Now, when you take it, oftentimes if you go in the emergency room and you take it, you're not just going to take it once, it's going to be back to back to back or what have you. Each nebulizer, I want to say each neb will usually last you about 5 minutes. Take 5 minutes to get into your system rather, and then as needed, you take it again. But that's what that is. So for me, it's a lot more effective than just taking your inhaler. Unfortunately, you get to the point where your inhaler doesn't really work anymore, and you have to get that constant feed of medication, and that's what the nebulizer does.
No, I appreciate you sharing that. And I think it's so important while you were sharing who is part of your care team and who may not have been earlier but is now, and kind of sharing the resources where, items that are covered by OHIP or what have you, because like you said, it's expensive and we want to be cognizant of everyone's socioeconomic status. And I think the beauty of what you said is because you are well versed with yourself when it comes to asthma, you've taught yourself. And I think that is why it's so important to have patients at the table, because the idea is for self-management, right? Because asthma can happen at any point in time. You need to, like you said, you were waiting. They said 8 hours. You
Yeah.
knew I can go to my car. Let's use my nebulizer. This is what I'm going to do. This will keep me going until I can be seen. And I think that's the gap that we need to address, whether it's, like you said, through education, through policy changes, through various devices, mobile health apps, you name it. The idea is to allow patients to self-monitor, because when you self-monitor, you're able to empower yourself. So whether you are going skiing
Absolutely.
in Whistler, okay, the altitude has changed here. Okay, no, we have wildfires happening here in Canada. Okay, so the pollution. So you're able to pinpoint and know and be proactive. I think that's how you said, like you mentioned, that's how you can prevent ER visits. Sometimes it is absolutely necessary, and that's what the ER is there for. Absolutely. But if we can be proactive and prevent those visits, I think is key. And so I love how you kind of mentioned that self-management piece where you've taught yourself and sharing those resources so individuals in the audience, whether it's yourselves, a loved one, you name it, so that how they can also get that. I think where you said about your care team, where a physician, a family physician or what have you, may not be as well versed about asthma. They may know the core of it, but like you said, like even in physiotherapist, when I was, doing my master's at U of T in physiotherapy, we had various units. So cardio arrest, musculoskeletal, you name it. And
Yes.
everyone kind of wanted to specialize, even pediatrics. And so everyone, as you built those years of experience or what have you, and you specialize, you would have more knowledge base about that. Like a cardio arrest physiotherapist would know more about, for example, asthma, COPD, as opposed to a physiotherapist trained in, solely musculoskeletal, what have you. Not that they can't help you, but their expertise. So I think it's the same idea, like you said, to get the expertise you need. So I appreciate you sharing that and how people can get that help. I know we spoke a lot today, and so thank you so much for taking the time to have this conversation, shed that light, being open, being vulnerable to share this insight so that individuals can understand the importance of having patients at the table, understand the importance of self-management, navigating, seeking out that education, and how you are trying to be proactive and advocate and have these conversations. As we wrap up, just as a last question, is there anything else that you want to share or address, or any nuggets you want to share, whether it is to an audience member that is experiencing asthma themselves, have a loved one, maybe a healthcare provider, or the general public, just in general, any nuggets that you want to leave the audience with that we may not have tapped into before we wrap up today? So Josh, I'll just kind of open up the floor to you if there's anything you would like to add and share.
Absolutely. So I think it's easy to be intimidated by doctors, clinicians, what have you, when you go in as a patient. Now I work alongside a lot of these individuals now. I speak with them almost daily, like whether it's for my podcast or as part of my advocacy work in one way or another. And I'd like to say that a lot of them have become my friends at this point. And what I have learned and what they have told me themselves is that it's incredibly important for the patient to self-advocate for themselves. So if you feel like maybe you're, I don't want to say misdiagnosed, I'll use that as an example. Somebody doesn't understand your lungs, a medication's not going to work for you and you know it. Don't just nod your head and go along with it. Talk to that clinician. Allow them to understand really what that means to you, how you feel about it. It's incredibly important to self-advocate. Now, the last two doctors I had on my podcast, Dr. Pianosi just retired from the Mayo Clinic. He was my respirologist at the Sick Kids in Halifax, Nova Scotia years ago. And Dr. Alan Kaplan, I asked the same question. What are your plugs? What would you like to leave to my listeners? And they said, do not be scared to self-advocate. Self-advocate for yourself, even if it makes me look like, you know, an ass or whatever it is. I apologize.
All good.
Self-advocate. Do not be scared to do that. And I think that's incredibly important. And own your illness. So whether it's asthma, cancer, COPD, I mean, you have a broken leg, it doesn't matter what it is, own it. And when you own it, you know, you can truly make a difference, not just for yourself, but for other people. And I think that's important. And I'll leave it at that.
Yeah, no, it's beautiful. Thank you for that, Josh. There are so many good nuggets there. And I'll kind of just recap there where you said own it. I remember, I forget where, this was another podcast I was listening to as well. And one of the speakers, she said the same thing. And she said, own you before they do. If you come to the table and be
Absolutely.
like, I have this condition, or I have this, there's no way someone can, because sometimes we kind of shrink ourselves when we feel that people are, they're pinpointing that. But if you own it and you come to the table, it's easier said than done, not being very cognizant of that as well. But I think to your point, it's important to own you before they do, because when you own you, then there's no way that they can, poke holes into that because you've owned it.
That's
So I
right.
think that's beautiful that the way you said that. And also about self-advocating. I think that is so important in terms of speaking up, whether or you don't understand something. I think that's beautiful. When I was in school, completing or not completing, but was in school for my master's of physiotherapy for the musculoskeletal unit. I remember one of her professors, she told me the same thing, or the whole class actually, where she was like, sometimes a patient will bring up something and you may not know it. And like you said, sometimes the clinician may not know. She's like, I will open up my textbook from the time I was, and this is like, I'm dating myself. So when we were in school, we still had textbooks. And so she's like, I'll open it up and let's go through the anatomy textbook and figure out what was, what is different from what you're telling me, that what I'm experiencing. So I think, like you said, it's so important, and they're open to it as well, right? Being like, okay, if we're not pinpointing this, who can help you? What am I missing? Do we need to run X, Y, and Z to figure this out? And I think having those conversations, obviously having boundaries of respect or what have you, but still advocating for yourself is so important. So we'll kind of close off there. Thank you so much once again, Josh, for sharing your journey with us, being open with us, sharing all these nuggets. Really appreciate you taking the time to speak with us today.
Thank you so much for having me. It was a pleasure.